Extraction is a simpler and usually cheaper option to treat a tooth infection. However, you will lose the tooth for good. And this is why the root canal treatment can be beneficial, because root canal treatment, on the contrary, can help you keep and conserve your tooth. Hello, my name is Dr. Jonny Lee, and I'm a dentist with a special interest in root canal treatment working in London. Today, I'm going to talk about a tooth infection and root canal treatment. So, what is tooth infection and root canal treatment? Tooth infection can be caused by lots of things, and they can be multifactorial. The most common cause of tooth infection is a rotten tooth or a cavity, which is also known as dental caries. When this dental caries, which is full of germs, bugs, bacteria, becomes deep and left untreated, it can reach the nerve of the tooth, which is called the pulp. The pulp is a very important part of the tooth because it contains the blood vessels and the nerves, and it keeps our tooth alive by providing moisture and the nutrients. When this pulp is infected by bacteria and eventually becomes dead, you can start feeling the pain and the other symptoms from the tooth. And this is when you know that you will need a root canal treatment. It is very important to treat this infection as soon as possible because any untreated or left infection can cause further damage to the tooth, and it can even spread to the other parts of our body. So what are the common symptoms of tooth infection? So the most common symptoms associated with a tooth infection are pain and swelling. Pain includes increased sensitivity to hot and cold temperatures, or even the increased tenderness when biting food, even the soft ones. And this pain can become more consistent and more severe if no treatment is given. In addition to this pain, swelling is also a common symptom of the tooth infection, and it occurs when the infection starts to spread into the surrounding tissues. So, how do we prevent this dental infection or tooth infection? The main reason for this tooth infection is decay, and decay is bacteria, germs, or bugs within our tooth. You could simply prevent this decay, and the best way to prevent it is by brushing your teeth 2 to 3 times a day with a good toothbrushing or even flossing as well. Another important prevention is diet control. So diet control is also very important. For example, reducing your sugar diet or soft drinks can actually prevent you from getting this dental decay and eventually tooth infection. So how do we diagnose a tooth infection? A thorough assessment is always essential before diagnosing any tooth infection, because there are multiple reasons why your tooth can be infected. Usually, we carry out this assessment over clinical and radiographic examinations. Clinical examination includes the assessment of the tooth and its surrounding tissues, or gently tapping the affected tooth, or applying hot and cold temperatures on the symptomatic tooth. Radiographic examination includes ordinary x-rays and more recently a 3D CBCT scan as well. So all this assessment, they help us to find the reason of the tooth infection and to correctly diagnose the condition so that we can provide the right treatment for the patients. So how do we treat this dental infection? The main treatment options are extraction of the tooth or root canal treatment. Extraction is a simpler and usually cheaper option to treat a tooth infection. However, you will lose the tooth for good. And this is why the root canal treatment can be beneficial, because root canal treatment, on the contrary, can help you keep and conserve your tooth. The main purpose of the root canal treatment is to clean the infected root canals, making them clean and sterile again, and to fill them with the biocompatible material so that infection won't happen again. The treatment itself normally takes about 1.5 hours to 2 hours, and it can take up to 2 to 3 visits, depending on the severity of infection or root canal anatomy.